The first axis is gastrointestinal disorders. The digestive system and the oral cavity are directly connected. The main mechanism here is reflux, which may present in two distinct forms. It may be an established disease, gastroesophageal reflux disease, GERD, a multifactorial condition that may involve dysfunction of the lower esophageal sphincter, hiatal hernia, delayed gastric emptying, increased intra-abdominal pressure, use of certain medications, smoking, obesity, among other factors. Or it may be an isolated event related to specific dietary habits, vomiting episodes, or particular moments in the patient's life, without necessarily having an established disease. In both situations, the impact on the oral cavity is the same. What reaches the teeth is highly destructive. Gastric acid, predominantly hydrochloric acid, may reach a pH below 2 and dissolves dental enamel with an efficiency that no extrinsic dietary acid can match in frequency. But the damage does not stop at enamel. Pepsin, the proteolytic enzyme present in gastric juice, has the capacity to degrade dentinal collagen. And this is fundamental to understand. Dentin is not only mineral, it contains an organic matrix rich in type 1 collagen, which is responsible for part of its resistance and flexibility. When pepsin destroys this collagen, dentin loses structural integrity. It becomes friable, breaks apart easily, and becomes extremely vulnerable to any mechanical load, even simple toothbrushing. And at that moment, what should be a hygiene habit becomes an additional destructive factor. The saliva of patients with active reflux is contaminated with hydrochloric acid, which means that the entire oral cavity is under attack, not only the regions of more direct contact. The wear pattern this produces is characteristic, diffuse erosion, frequently more pronounced on the palatal surfaces of maxillary anterior teeth, but potentially widely distributed depending on the frequency and intensity of reflux episodes. The second axis is psychological disorders. Anxiety, chronic stress, and depression have a direct relationship with non-carious diseases, and this relationship